What are the limitations of your diabetic treatment team? Your diabetes care team should include a variety of healthcare providers. Each will play a very unique role in your health. There is a reason a specialized diabetic team, such as a certified diabetic nurse educator and a dietitian, are integral to your primary care and support team. Today, we will cover a number of very important factors directly related to controlling your diabetes for a healthier and better you. Two major points we will cover today. What are the true limitations of your doctor? And what I'm about to say will shock and surprise most of you. Two, what questions must you ask to find that great doctor once you're diagnosed? Get a pen and paper out because you're going to want to write all of this down. These are life-saving pointers you will not find anywhere else on the internet but here, the Resilient Diabetic. But before we begin, let me welcome all those brand new faces, those new Resilient Diabetics out there. This is where we turn ordinary struggling diabetics into extraordinary, well-controlled diabetics. If you don't know who I am, let me introduce myself to you. My name is Sampat, and I am an insulin-dependent diabetic diagnosed a little over 5 years ago. So the proud owner of a pancreas that seems to have gone on a permanent and lifelong vacation. So not only am I diabetic like you, where we will be walking the walk and talking that talk together, but I do also have a University of Bachelor's Science degree in nutrition dietetics, and that comes in very, very, very handy in discussing all the difficult intricacies of being a diabetic. If you like what you see here today and you want to learn more, then I do highly suggest you hit that subscribe button, the like button, and of course the notification icon, which is the gray bell, so that you don't miss a second of any of those upcoming episodes that will change your life. I had to go through 3 doctors initially before I felt comfortable with the one I have now. I have high expectations and high lofty health goals to accomplish regardless of the diabetes. So I needed a doctor who was extremely well versed. Him and we actually worked very, very well together. My educational background has also helped us out both tremendously, honing in on a solid game plan that's helped keep me both fit, and I can say even fitter than what I was before the diagnosis, but also more importantly, feeling great and energetic throughout the day. He has actually allowed me to take the reins, so to speak. And that is what I want for you in particular, to not only have great and well-controlled glucose numbers, but as importantly, to have that energy and drive in life each and every single day. Who is the single most important member of your healthcare team? Question. It's you. It's you, folks. You are the ones affected by diabetes, the daily blood sugar swings, the battles, and then cares for it every single day. Only you know how you feel. Only you know what you're willing to do or are able to do. Only you will do the necessary exercise, the cardio, the gym. You are the one who decides what to eat, makes the food based on your daily and sometimes incredibly hectic schedule. You're the ones that take the medicines. You are the one that has to inject the insulin. You are the one poking your fingers, checking blood sugar levels, and then keeping the track of all those results. You are also the first to notice the problems, and then you've got to deal with them. From the hypoglycemic episode that just appeared out of nowhere to the high blood sugars that are causing you to feel lethargic. So you need a healthcare team you can trust, a team you can talk to, a team you can be honest with about how you feel. And most importantly, a team that's got your best interest at heart. One with real solutions and advice that you can honestly follow. What I am seeing today is a lot of frustrations with the healthcare team that many of you are facing. And it first starts with the doctor. Choose a doctor who understands diabetes well or is willing to learn for your sake. If you are proactive, looking for a great new doctor, your visit should include some time for you and your doctor to get to know one another. Make sure you feel comfortable talking about the details of your health, your lifestyle, with this doctor. This is actually where you're going to interview the doctor. Remember, they work for you and you are fighting for your health. First question you're going to ask, do you have specialized training in diabetes? 2, are most of your patients with diabetes type 1 or type 2? 3, what tests will you do at the office visits? How often will you order these tests? What days do you work? So who covers you on nights or on weekends? That's really important for those of you who are just diagnosed. Are you associated with any other diabetic care professionals? Who is part of the team? So finally, you need to ask your doctor, will you be referring a diabetic educator or a dietitian? Now, after each visit, you must also ask yourself these questions. Did the doctor really listen to your concerns and to your worries? Was the doctor truly concerned about your diabetic control, or were you just another number? Here's the honest truth. Most primary care physicians have between 7 to 22 minutes of time to spend with each patient. So did the doctor answer all your questions? And more importantly, can you go out and implement that game plan? Or were you thoroughly confused but afraid to ask more questions? If you were not happy with any of those questions, then go find a new doctor. This is your life, your health we're talking about. You and you alone have to deal with losing your eyesight, your toes, your kidney functions. So you need to get this right from the very beginning. Now, this is the shocker for many of you. As you know, diabetes is a disease directly related to food and nutrition. It's about bridging the right medication programs to the right diet. So looking to your doctor for nutrition advice may be the biggest limiting factor. And here's why. Only 1/5 of American medical schools require med students to take a nutrition course. Today, most medical schools in the United States teach less than 25 hours of nutrition over 4 years. Less than, get this, 20% of medical schools have a single required nutrition course. The biggest thing that drives medical schools is what gets tested on their medical board exams. And unfortunately, right now, doctors are not tested on nutrition. But I want you to think of this reality. You're at your doctor's office, and sitting in front of you at the doctor's office waiting to be seen are patients with myriads of conditions. There's one sitting in front of you with what looks like bee stings. One across the room with the flu and probably has about 102-degree fever. There's another one sitting across the room with migraines. And another one just opened the door, hobbled in with crutches, and guess what? He fell off his roof. There's an interesting one across the room. You can't figure out why he's there. Unbeknownst to you, he's there because he's losing his hair. Each one requires different medications, different courses of action. Do you expect, with what you know now, your doctor has the time to study the latest research on non-nutritive sweeteners, on diet sodas, let alone this food, that food? They've got far more pressing issues they've got to deal with. They don't have the time for that. They have to keep up on the hundreds and hundreds of medications, new and old, related to their practice as a whole, let alone diabetic requirements. And the reality is this. It's not realistic to expect physicians to be experts on everything, especially nutrition. Now you know why. What may be worse, they may have a preconceived notion of what is good or bad for you based on their personal or religious beliefs. If your doctor happens to be on a keto, Atkins, low-carb diet, guess what? You will too. If he or she's a vegetarian, vegan, guess what? You will too. And don't even get me started on that. This is why the team of diabetic educators and registered dietitians are key to bridging that gap for you. They are the ones who should cover the basics of nutrition for you. How to read food labels, what a protein is, what a carbohydrate is. Do fats raise blood sugars? Most importantly, how to use your single most important tool you have as a diabetic, your glucose meter. Regardless if you're told you can eat this or you can eat that, it is your glucose meter that will be the final judge and juror as a diabetic. Some of you will find that perfect doctor and team at first. Some of you will struggle to find a great doctor. Maybe you are one of the unlucky, newly diagnosed diabetics given a bag of medicines, shoved out the door, and told to come back in 3 months for your next A1C, not even knowing the basics. So what do? You go to the internet, asking questions to strangers who do not even know your true diagnosis. Diabetes, as I have said, is a lifelong learning experiment. It's dynamic. Sometimes what worked for you yesterday doesn't work for you today. This channel is to help you take the reins because ultimately, even with the help of those experts, you have to deal with this disease. And if you're anything like me, then we will be fighting the fight together. And that's why you're also going to subscribe to this channel. In the comment section below, tell us about how you were first diagnosed. Did you find that helpful medical team? Or were you one of those lost, shoved out that door for the very next number? I'm seeing that far too often these days, and it literally breaks my heart. I will add a playlist for you called What Can a Diabetic Eat or Drink? It would have a multitude of videos from what to have for breakfast to is oatmeal healthy? Can diabetics drink alcohol or diet sodas? What about pizza? I'm going to put that right there for you and create a link that you can click. If you are on a desktop, use your mouse. If you're on your mobile cell phone, just tap it with your fingers. So, have a great day, a productive day, and we will see you soon with another episode, always released weekly. Bye for now.